You're live. Hi.
Oh,
Click this button to
yay.
share your browser. No, we don't want to do that.
Okay.
No. Hi. Oh, I'm not used to being over there.
I know this looks weird.
It
We're
does look
usually
weird.
swapped.
Yeah, that's okay.
Okay.
Hi. Good morning. Oh, I'm so excited.
I'm so excited too. Thank y'all so much for joining us.
We have people. Hey,
We do have people. We didn't think
It's
we'd have
exciting.
anyone.
Yes.
So
Yes.
we're excited.
Okay, so just like a quick introduction, if you don't know who we are, I'm Nichelle Haynes, and this is Kristin Lasseter. Sorry, maybe you could introduce yourself.
That's okay.
That's rude. So we are reproductive psychiatrists in Austin, Texas. Oh, we got a mic. We are here on YouTube to provide you with evidence-based information about your reproductive mental health, which means
that we focus on mental health in the reproductive hormone changes. So reproductive hormones are essentially estrogen, progesterone, and testosterone. But in women, estrogen and progesterone are the ones that kind of fluctuate, throughout your menstrual cycle. They fluctuate big time in pregnancy and way big time in menopause, perimenopause. So we talk about mental health issues that arise because of those changes in those reproductive hormones.
Right. So we are active here to give you the information that you need to make informed decisions about your health. And also because it's fun for us. So we hope that we will just have a little bit of fun today and talk to you and answer your questions. So if you have questions, please put them in the chat. We're happy to answer them. We have a few questions from our Instagram pages that we put on earlier this week. And we'll pull those up.
Yeah, I'm gonna pull them up. Okay. So our first question, we actually got a few questions about sleep in pregnancy, but our first one is, what sleep medications can you use in pregnancy? And I think we should start off by just saying that sleep in pregnancy and postpartum is super important. I mean, sleep anytime.
Right.
Is super important, but especially when you have these hormones fluctuating. So what happens is, in your brain, these hormones fluctuate and they, create changes in your brain, and they actually create those changes in the areas of your brain that are responsible for emotions, behavior, memory, reactivity, all these things. So it makes sense that, pregnancy and postpartum is a time when mental illness can pop back up, because that's also where a lot of mental illness symptoms come from. So you think about, you already have these changes going on. You need that stability as much as possible. And when you're not getting good sleep, your brain's not at the top of its game. And so it's not functioning like it's supposed to be.
Right. So when I'm talking to my patients, especially planning in the postpartum period, I will tell them about really, really trying to aim for 5 hours in a row and 7 hours in a 24-hour period. That's a really evidence-based way of supporting your mental health during the postpartum period. I think that is kind of a general rule anyway, but if we kind of put the parameters in there that we're kind of reaching for this amount of time in the postpartum period, that people know kind of how and what to look for. So we're talking about postpartum sleep or sleep during pregnancy. One of the questions that we got was, what medications can you take? And I think kind of just stepping back, you can do whatever you want, right? This is not you can or can't do XYZ, that you have the autonomy to make the decision that is right for you. We just want you to have the evidence-based information to make a decision that's safe and that you feel is right for you. So prioritize sleep.
Yes. And I think one thing we should say, just liability-wise, is this is not medical advice. So this is just general education on things that we've learned. We both went to medical school, psychiatry residency. We've both had additional training in perinatal mental health and prescribing medications in pregnancy and postpartum. So, this is just kind of the evidence is what we're presenting.
Right. This is for fun. Go talk to your doctor, please. We are probably not your doctor. And if you are one of our patients, hello, please talk to us during a visit. Okay, so sleep during pregnancy, what medications would we generally consider to be on the safer side?
So I think first, like if we're starting at the very first line thing, it would be doing CBTI. So,
which is cognitive behavioral therapy for insomnia. It is the most evidence-based treatment option we have, and it doesn't come with, like a chemical component of taking medication. So we do like to recommend that first, but we do understand that for some people that's not the right option, or they've done that and they're still kind of struggling, or there may be some other reason why that's not accessible to them. So CBTI is our first line treatment,
because it is also the most effective. So it's, in trials has shown to be more effective than medications, and even long-term, oftentimes a lot of our sleep medications kind of lose their potency or they don't work as well long-term, whereas CBTI has the most effectiveness long-term too.
Right. And you learn those skills, right, is what it really is. You learn the skills to like help yourself sleep well. And so you can take those skills with you. So CBTI is our most effective option.
Magnesium.
So you want to get the magnesium glycinate. That is the most neuroactive. That is one. So I always talk to my patients, right? We don't want to have magnesium citrate because
or oxalate.
Yes, that's true too. But I say magnesium citrate because that is a laxative.
So is the oxalate one.
Yeah, I don't think it's as laxative inducing.
Doesn't make you poop as much.
Right. So I just tell them, like, you don't want the magnesium citrate because that is a laxative. And that you don't want to be pooping before you go into bed. That's not going to help your sleep. So if you are using magnesium glycinate, we want to use about 400 milligrams at night. You may have to work up to that. But that can be helpful for sleep as well. And I think there is some, like, not super quality data, but there is some data about it being helpful for anxiety as well overall. So that's a good option. I get a lot of people asking about melatonin during pregnancy. So I think maybe we should address that.
Yeah, that's a good point.
We don't love to use melatonin during pregnancy because it is a hormone. I can just get on my soapbox for like a second about melatonin. And it just comes in these astronomical quantities. Like, why does it even come in 10 milligrams?
Or if you go to the grocery store, it's really hard to find 1 milligram options, which is supposed to be kind of like
that's
the higher end dose.
That's a lot.
Like in research studies.
Yeah.
So, yeah.
I mean, I've taken melatonin a handful of times in my life, and I take a kid's gummy and I cut it. I just take a sliver off the side of it because that's essentially what your body makes on its own. So melatonin, we don't love in pregnancy because it is a hormone and it is neuroactive, and
we have no research.
Data.
We have no data on what it does. So we don't know, is it safe to take in pregnancy or not? It's and similarly with breastfeeding, melatonin secreted through the breast milk. So, I wouldn't mess with that.
Right, exactly. So we prefer to use things we do have some data around. So I think if we've kind of done CBTI, we've done magnesium, we're kind of moving into the next options.
I think the next most researched one that can be really effective is doxylamine, which is sold under the brand name of Unisom. But Unisom also has a different formulation that comes in diphenhydramine. So it's really important to look at the box and see which formulation you're getting. So you want doxylamine. And this is also a component of Bonjesta or some other ones that people use for treatment of their nausea and vomiting. So a lot of times people have already taken this medication at some point earlier in the pregnancy. So it's a great one since baby's already been exposed to it. And we want to reduce the number of things that baby's exposed to. Just reusing that one first is a good option. And so usually it comes in 25 milligram tablets. Some people don't even need that much. Some people need 50 milligrams. I would get the tablet so that you can break it in half and kind of, titrate it or figure out what your dose is.
Mm-hmm. So we have an additional question. Is there data somewhere on magnesium? Yeah, we have some data on magnesium, but I don't know any pregnancy-specific data.
Well, so magnesium in pregnancy is one of the important vitamins and minerals to take during pregnancy. So it's already, something that's like a part of your component for your prenatal vitamin, and just magnesium in general in the body. Like it's pretty hard to overdose. Like you'd have to be taking like over 1,000 milligrams or something. So there's like a wide range of what's safe to use in pregnancy.
Yeah. So I think when we talk about kind of one of the general principles of like perinatal or reproductive psychiatry is we really want to reduce exposure. So you already have magnesium in your prenatal vitamin. So we're not adding in an additional exposure here. So we, kind of utilize that as one of our principles.
Mm-hmm. Okay. So let's say you try doxylamine and that didn't work either. Like then we're usually moving into prescription medications. And a lot of times we want to use, again, the goal is to reduce exposure. So using something that is maybe baby's already been exposed to, or maybe we can use that medication for multiple things. So a lot of times that might end up being like Ativan or lorazepam or benzodiazepine that maybe somebody already uses as like a rescue medication for panic attacks. We might also use that occasionally if they're having trouble with sleep. Or what's another one? Like sometimes people are taking second generation antipsychotics like Seroquel as needed for anxiety, or they're already using it for their mood stabilization. And so we might use a little bit more of that to help with sleep.
Mm-hmm. Yeah. Of course, there are like additional like sleep designed options, like the Z drugs. So we have Zolpidem or Zeleplon. I cannot.
Zeppelinon.
That we
Ambien, Bongesta.
So I generally try to not use those if at all possible, based on the newer data that we have related to the safety of those medications during pregnancy. But if we need to use them, we do know that, not having good sleep is not great for your mental health anyway, and the health of your pregnancy and the health of baby and all of those things. So we kind of weigh risk benefit there.
Yeah.
We spent a lot of time talking about sleep. Let's move on to something else.
We did. Okay. Well, that also kind of answered, someone asked, what if you have severe insomnia during pregnancy and CBT and Unisom don't work? So okay. I feel like we kind of answered.
Too. Okay, good. Yeah. Good. Yeah.
What is the airspeed velocity of an unladen swallow? So
this is like
looked this up.
Typical nerd stuff, right? Like we were like, oh, what's unladen?
Googled unladen. And then we realized it's a joke.
It's from a movie, which if you know me, like I am like, one of my core principles in life is that I am kind of anti-movie. Like it takes a really long time and it's not for me. I love it for you if you love movies, but like I don't like movies. So it's apparently from Monty Python. Like I had no idea. Yeah. We were like Googling it. Like, how can we actually answer this question for someone?
We were just like, obviously it was a joke question, but I was curious.
Laughing at ourselves.
Yeah. But it's 25 miles per hour.
24.
24. Okay, 24 miles.
Maybe a fast
that
one.
Even means.
Maybe a stud swallow. That's 25.
Okay. How can I trust someone again after they have cheated? Ooh, that's a good question.
Okay.
I want to say that, first of all, it's not your job to work on trusting them, right? Like it's when somebody has, whether it's cheated or done anything to lose your trust, it's not your job to regain that or to work on trusting them again, right? Like you shouldn't be trying to force yourself. Like you can't really force yourself to trust someone. It's more on them. So they need to be figuring out, how do I regain this person's trust? And they should be asking you, like, what would make you feel more safe, or what would make you feel like help you in trusting me? And maybe in the beginning, that's like things that, would be, I don't know.
Like maybe it's like sharing your location or, checking in at certain times, or
it might be like what seems like unnecessary stuff, but to someone who has broken your trust, like that might be what you need to get back to trusting them.
Mm-hmm. Mm-hmm. Right. I think when someone cheats, we kind of think about what is the thing behind that. Are they, not getting their needs met? Are, you guys don't have clear communication around what is and what is not cheating. I think, just being able to establish that from the beginning and having an open and clear space of like, this is what makes me feel supported. This is what doesn't make me feel supported. So if you have that foundation and that still happens, that you rely on that foundation to come back to and talk to, and, you kind of work through that together. And I think also utilizing the resources that you have, right? Like if you can establish with a couples therapist that you trust, that you have a neutral party that can teach you how to work through this problem and kind of decide it's like, hey, it's me and you against that problem, that rather than me against you, which is like a really important thing to potentially try.
Yeah, that's a good point.
That's a hard one.
Yeah, it is a hard one. And I would say also there's some people who just in general have trouble trusting people, and that I think is a separate issue and something you should be working on with a therapist.
Yeah, understand why your attachment style is like that.
Mm-hmm.
Yeah.
What is your coffee order?
I will get a oat milk latte with like whatever sweetener they have.
Oh, I don't really have an order. I feel like usually it's a latte if I do get something, or just a regular coffee.
Just like black? You should put cream in it.
Yeah, but I'll like ask for cream on the side.
Yeah.
Usually.
You don't put any sweetener in it?
No.
I want the sweetener. That's what I do it for. I want the sugar.
Okay. How do I know when it's time to seek treatment? Oh, that's a good question.
So I think there's never really an issue to provide yourself the opportunity to gather more information, right? If you're like, I don't really know if I need help or not, like maybe see someone and see like, could this be helpful for me? Or talk me through my options based on what you're seeing here. Like, are you seeing that I'm at the point where I maybe need medication? Or are you seeing that like there's opportunity for therapy to be helpful for me? So I think I don't really think it's a negative thing to ever seek care or treatment. That really it's just about gathering information about what your options are and what you can do, because something that might seem like a small problem can grow into a larger problem. And if you catch it when it's smaller, then you might be able to like kind of keep it from moving into a bigger situation. I think generally what we would say is like what qualifies as a diagnosis is if it's preventing you from enjoying or living your life, or causing you significant problems in your life. Those are kind of like the two categories that we would say like qualifies as a disorder.
Yeah, if it's distressing to you, like your anxiety or your mood feels uncomfortable for you and you're not happy with the way it is most of the time, that could be a reason to go and seek treatment. Other reasons could be, it's impacting your sleep regularly, or it's impacting your relationships with other people regularly, or it's making it hard to function and do things like you normally would, or kind of be your normal self. Also, of course, if you're having any kind of like thoughts about death, like I wish something bad would happen to me so I could just have a break, or I wish something bad would happen so I didn't have to be here anymore, or thoughts of like, I want to harm myself because I just can't handle this anymore. Of course, those are reasons to go and seek treatment. And like Nichelle said, it's never bad to go seek treatment. So even if you're kind of unsure and you're like, I don't know if my problems are bad enough, like it's fine to go and talk to someone. Like, I don't think I've ever had a patient come in, even if it's for therapy or even if it's like medication, where I've been like, that was dumb. Why did you come see me? Right. If anything, we can kind of talk through, okay, like these are the options. I wouldn't recommend medication yet. this is when I would, and, what are some things that we can do in the interim or before we even need to get to medications. And like Nichelle said, it's better to catch it early. So if you like depression, anxiety, you think about like going back to it being an actual disorder in your brain's not functioning like it normally does. Its cells are, not interacting with each other normally, just like if you were to have some dysfunction in like your heart or something else. And the more time that goes by that those cells are dysfunctioning, the harder it is to get them back on track. Just like, if you have some sort of heart disease, the longer you let it go untreated, the harder it is to treat and get it back to normal. Mm-hmm. Same thing happens with your brain. All of our cells in our body kind of work in the same capacity in that way. And so it's better to address it earlier than later.
Yeah. So if you're questioning, should I? Maybe the answer is yes, just to have the information about what your options are.
Yeah. Okay. What's normal anxiety in pregnancy versus not?
I think it kind of touches on what we just talked about before, right? Is it causing you problems? Is it causing you significant distress? How much time do you spend feeling anxious? Is it impacting your relationships? Is it impacting your sleep? Is it impacting your ability to enjoy this time?
To focus on other things.
That's a big one too.
Because it is normal to have anxiety or more worries in pregnancy. Like totally. That's a scary time, especially if you're living in the United States, this climate, like, what can go wrong and what, medically, what are my options if something does go wrong? Like there's just so much to worry about. And so I think that is valid and normal. I think when it's not normal is when those worries keep coming up so frequently, then it's hard to do other things, or they're really distressing to you. Like it should be like, here's a worry. Okay, that's likely not going to happen, and you can kind of move on from it.
Or even if we know that there is a high likelihood of that thing happening, I think this comes up with a lot with miscarriage, right? Even if we know there's a high likelihood of that thing happening, it's like, that is going to be really, really hard for me. And I know I can get through it, right? Like it's going to be hard. I'm not calling it like rosy or anything like that. It's like, I have support systems. I can lean on people. It's going to suck, but I can do it. Yeah. Right. So I think anytime you have uncertainty, that's, oh, hi. Anytime we have uncertainty, that's like a prime soil for anxiety to kind of like seep in and like kind of catch hold. So uncertainty makes sense. And it's kind of like being kind to yourself in that situation and seeing how much is this actually really bothering me.
Yeah.
Hi, Heather. I do remember you. Yes.
Okay, books we recommend for moms. So I don't have a lot of books I recommend, but the one I think that has been most helpful for me has been Pooja Lakshman's book called Real Self-Care, because I was reading it and I just felt so validated. Like all the things that I've struggled with and have felt like, oh, I just can't do it all. Like I'm failing, I suck, all those things that come in as moms, like, oh, I'm a terrible mom. It was just so validating to read and be like, oh, like this isn't my fault. And this, this is what's wrong, like why I feel this way. And here's ways, things I can do to make it better.
Mm-hmm. Right. I really, really am enjoying that book. I recommend, there's a bunch that I recommend. I really recommend, it sort of depends on like kind of on their lean or what the issue is. There's like a pregnancy and postpartum anxiety workbook that I think is pretty good.
Yeah, that one's good.
On our Amazon storefront, we have like a books that we recommend section, so you can go in there and look at it.
I will say the book that was like my Bible in pregnancy or in postpartum was Healthy Sleep Habits, Happy Baby or Happy Child or something. And it's a book on like the importance of sleep for kids, what's normal, what's not, like all the different things that might happen and how to address them. I think it goes all the way up until like the kid's 5 years old. Like, what are some strategies? What is sleep supposed to look like? And it's been amazing. Like, my kids are great sleepers, and I feel like it's been amazing for, you know, like helping kids grow and develop, because you think about how important sleep is for our brain. It's really important for our brain as it's like expanding like crazy. And it like goes through different strategies, right? So it's not just like,
hey, sleep's important, figure it out.
Or that. But it's also not like, here, you know, this, you should do cry it out, or you should do whatever. It's like, here's the range of things that might feel comfortable for you. And, you know, depending on what way you want to sleep train, or which way, you know, you want to help your child sleep. So it's been awesome.
Yeah. Yeah. I also recommend Whole Brain Child. I really think that helps parents when kids are dysregulated to help regulate themselves. Because a lot of the issues that I've personally dealt with in raising kids is like my reaction to their stuff. And if I can understand, like, okay, they don't have a frontal lobe, like this feels really important to them, we kind of put it in context, that it's really easier for me to like kind of come down and be able to co-regulate with them. So I think that one's really good as far as like if it's really for parents to help their children. But I find that like once they understand, that it really does also help them too. So I like that one a lot. Whole Brain Child.
It's good. I like that. Okay, we have one more question, and then I think we can wrap it up.
Yeah.
So that we're not on here too long. What did you struggle with most postpartum?
Freaking everything. Everything. It was so, I was a resident. Yeah. Well, it depends on which kid. Postpartum with which kid, okay. I would say. Do you want me to go first? I'm just
you go first.
Going first. Okay, so with Gavin, with my older child, he came during residency. And so, you know, the transition to parenting is really difficult, and just trying to figure out how to be in the world when you have a kid, I think was really hard. And I really struggle with breastfeeding him. Like, I had plenty of supply, but he could not tolerate my breast milk. And I tried everything and just felt like I just like kept digging in, like, let's cut out dairy. Let's cut out like anything with any dairy, any, you know, microscopic thing. Let's cut out citrus. Let's cut out vegetables. Let's cut out this. Let's cut out that. And so by the time he was 6 weeks, I was like, we have to move to formula. And I had a completely different baby after that. It was like, sleep. But the second one, like, that was just like a super crazy time in my life. And so I was moving, I was starting a new job. I got fired before I started, which of course is not related to me. And then I got promoted after I got fired. So weird. And then I was like commuting, I was studying for boards. I was like in a new town. I struggled with everything. I was like a huge transition. So I struggled with sleep. I struggled with mood. I struggled with pumping. I struggled with my new role. I struggled in my just all the things, everything. Yes. Okay, what about you? It's going to be a simpler answer. I struggled a little bit.
No, I mean, with my first, so I was also a resident in psychiatry. I think it was in my second year of residency or third year. I don't know. It was a hard time anyways. And I was so burnt out on residency, like even during the pregnancy, it was awful. And then I had my daughter, and I definitely struggled with postpartum anxiety. And at the time, I, didn't really know much about it. So I was like, this feels really hard, but I'd also never had a kid before. So I was like, maybe this is just what it's like, or maybe it's my fault. And it was awful. I worried about everything. I was so worried about her. I had several doctors who were like, you can take Zoloft and breastfeed, it's fine. And I was like, no, I don't want to put anything in her that's bad. Yeah. Which it would have been really helpful if somebody would have sat me down and been like, this is what anxiety is. And
But you're a resident,
I was
right?
a psychiatry resident. I should have known what.
But the thing is, like, this is really important is because a lot of times we're the last to know if we're feeling bad. Right. And we just think
usually
like this is normal. We
blame
internalize it. We blame ourselves. Right. So you know what anxiety is. You can read off the definition.
Yeah.
But like experiencing it and knowing what it is are two completely different things.
Yeah. So it was, I mean, I had, definitely had anxiety. So it would have been helpful if someone would have sat me down and been like, you're having postpartum anxiety. These are the risks. If you're not going to treat it, these are the risks to your baby by not treating postpartum anxiety. Like, in the end, I was probably doing her more harm by not taking the medication than I was, just trying to tough it out or thinking like, oh, I should get this, or I just need to work harder or whatever. So with my second, I had finally started medication with my first, like at some point postpartum. And then I stayed on that through my pregnancy. I stayed on it postpartum, and it was like magic. Like I felt like immediately bonded to her. I like was just so in love. Like it was just this beautiful experience. I mean, of course it was still hard because I had like an 18-month-old and a baby. And so that was, chaotic, but it felt like, okay, I can handle this. And like, this is going to pass. And, I got to enjoy kind of the moments with both of my kids at that point. So yeah,
I'm so glad. That is actually one of my most favorite things in treating is when you see someone through their first postpartum period and it's so hard and you just see how much they're struggling and you kind of like move in the right direction and they feel better. And then you get to stay with them through their second
yes, I love
that. It is so rewarding for me personally to see someone like kind of like go through their pregnancy and process the new things, and you built this trust with them. You say like you're gonna be fine, like we're gonna make it work for you, like whatever.
Because a lot of them are really worried, like I don't want to experience what I did the first time, and that's totally normal worry. And it kind of having all these plan A, plan B, plan C, like we're going to get you through it. It's not going to be like it was the first time. And for most people, it's like, they just stay on the medication and they have like such a wonderful experience. And it is rewarding.
That is one of just like, I live for that. That is just like such the best thing to like see them. And then they have this like period of processing how difficult the first one was, even though they're with you and they're processing the thing and they're like talking about how hard it is, like to have them kind of reimagine or have a deeper understanding of just how hard it was. Like, have to have more babies with me. I really love it. And like, so rewarding for me to like get to be a part of that. Oh, so great. Okay, we have one more question.
Right.
One more.
No, I think we're done.
Okay.
Or did you want to answer that one?
I want to answer it.
Okay, so the other question was,
I talk about Taylor Swift all day.
Your favorite
Torture Poet Department song.
Yeah.
Okay, I think mine is So Long London, although I have a bunch of different songs and I could talk about it all day. I could do like a whole like 2-hour thing about like all the different songs and why I like them and blah, blah, blah. But I think So Long London is like my favorite. And then of course I Can Do It With a Broken Heart.
Yeah, mine is I Can Do It With a Broken Heart.
Of course. Yes. That makes sense. That's like it's a jam.
It is.
Thank you for being here with us.
Yeah, thank you so much.
Okay, subscribe to our channel if you're not already subscribed to our channel. And then, of course, leave us more questions in the comments if you have them. We're happy to like answer them at any time.
Yeah, we're always looking for more things to talk about that, it's hard for us to know, like, what do people want to know more about? So definitely like send us, if you don't feel comfortable like posting it on social media, like feel free to send us, a message on Instagram or, I don't know, email us, whatever.
Yeah. Okay. We're so happy to see you. Thank you for being here.
Thank y'all so much.
Okay.
Have a good day.
Bye.